Alfio already gave a very nice presentation of his activities, and of course, I like to stress his role, his pivotal role in our project, a art project. Is our coach, and is helping us going in the right directions and correcting our, let's say, departure from the paths, the correct paths, when we tend too much. When in our mathematical developments we tend to underestimate the importance of physiology and pathology. It's my pleasure to give now the floor to Tony Corno. He's going to give a talk titled Fibonacci Sequence in the Universe, Nature and the Art. And please, Tony, go ahead.
Thank you so much, Luca, for your very kind and generous introduction. My talk is supported by the chairman of my department of pediatric cardiosurgery, Dr. Salazar, who, curious enough, started as a mathematician, so graduated in mathematics, but after that he has seen the light and decided to become a pediatric cardiosurgeon. This is the hospital where we work. This corner is all the pediatric children hospital, and this tower here is the Memorial Hermann Medical Plaza, where there are all the clinics and the offices. And we are in the complex of the largest medical center in the world, which is the Texas Medical Center, with 60 hospitals in a square mile. Let's move to the topic of the talk now. All the mathematicians know that Leonardo Bonacci from Pisa was nicknamed Fibonacci from the Toscan dialect, son of Bonacci. And this is a very important book that I have received as a last Christmas present from my family, and they allow me to learn about the Fibonacci rabbits. We heard about Pythagoras from the previous speaker, and in fact, Pythagoras was the first one who discovered the golden ratio, followed by the Euclid, both centuries before Christ. And the name golden ratio has then been changed in golden section in the Latin language. Fibonacci in the 12th century came out with a sequence of numbers called Fibonacci sequence, translated geometrically in the production of the spiral. But curiously enough, Fibonacci in his Liber Abaci, or Book of Calculus, never ever mentioned Pythagoras or Euclid. Now, the first part of the presentation of the spiral is in the universe, where it's quite familiar to everybody. Then the galaxies have a spiral shape, and they have a preferred direction of rotation. They can be right-handed or clockwise, or counterclockwise left-handed rotation. And someone of Italian origin working in the University of Michigan, Michael Longon, made the observation that 90% of the galaxies rotate clockwise to right. I ask you to remember this information. Coming down on Earth, the hurricanes are also having a form of spiral, and is well known that it can rotate anti-clockwise or clockwise according with their position in the northern or southern hemisphere. When we hear about hurricane, generally we think then they always occur somewhere else, and we can follow them through the media. Well, it's not always true. This is my first personal experience when I moved to Texas 1 year ago with the Hurricane Laura. I'm sure you recognize this is the south part of the Texas, this is the Florida. This was the center of Hurricane Laura, and that's the location of Houston. So that was my first personal experience with the hurricane. If we move to gargantuan or extra gigantic relative, the spiral shape of the galaxy is exactly the same spiral shape than we can find in the ionic channels. And we will see the calcium channel later, talking about the heart. Gargantuan relatives can be found from the fingerprint to the relationship between space and time. Then I don't need to explain to the mathematician. In the very, very small, we can find a spiral shape in the DNA. And again, by chance or not by chance, the relationship between the minor groove of the DNA spiral and the major groove of the DNA spiral is perfectly represented by the golden section. If we move to nature, the spiral is perfectly reproduced in shells and snail, as you can see here, and in the other representation. Curiously, again, 90% of the shells and of the snails rotate clockwise to right and 10% counterclock. Spirals are found in the horn of many animals. You can see here a spiral in the spiral, and look at the position acquired by the trunk of this elephant, perfect spiral. The same is valid for the trees, where the leaves and the branches are absolutely growing following a spiral shape, as you can see in this majestic oak. The same is for the flowers, the sunflower or the rose, where again, the spiral is always returning. If you look at the pine cone, you can see how all is translatable in the spiral shape. Spiral is present in the architecture. There are spiral features in this Neolithic tomb in Ireland or in the pillar of a Greek temple. Modern architecture, again, we find a spiral. This is the Sagrada Familia in Barcelona. Spiral returns in the sculpture. In music, the golden ratio is used to produce a violin. Fibonacci numbers are following the key of a piano, and all the music scores are following the Fibonacci numbers. Are there exaggerations in seeing the spiral everywhere? Maybe this is not an exaggeration if we analyze the egg shape. We don't know if Leonardo was familiar with the spiral, but Leonardo was a genius, so probably he had the spiral in mind when he painted Mona Lisa. And I will not do comments on this. If we move to the heart now, the spiral is present in the cardiac channels for the calcium, essential element for the contractility. As you can see here, spiral is present in the actin and myosin, the two key elements for the cardiac contractility. And this is the actomyosin complex that is evidently having the shape of a spiral. Here you see a DT representation of a human heart with left ventricle, right ventricle, and you see the myocardio-ventricular band then is absolutely represented by a spiral going from the base towards the apex is a real spiral. And as you can see in this, something wrong, sorry about that. Well, everything is blocked. I apologize, but my laptop is making tantrums. And I have no idea how to go out from this or move back and forward.
Tony, try pressing the arrows on the keyboard.
Yeah, but the problem is this rainbow ball rotating, then doesn't allow me to do anything. Sorry about that. I tried endless time, and this is the first time that happens.
Maybe ask.
And I tried, no way.
Okay.
If you have any IT suggestion, it would be more than welcome. But I cannot go out, I can do nothing.
So,
But if the ask is not working,
No.
so
do you have a Mac or are you using
Mac?
Okay. Can you move the cursor to make stop sharing appearing in the page?
Stop share, yes.
Yes, okay.
Share again.
Check if you have controls on your slides now.
Where?
No, can you move? We are not seeing your slides now.
Yes,
but
I have the cursor. So can I start sharing again?
Yes, go to on the following slide and then share again. Okay, we are seeing your screen, not the slides.
I lost the connection. New share. Okay, desktop. The slide completely disappeared. I lost the slide. That's ridiculous.
Okay, stop sharing again, Tony.
Stop share.
Okay, perfect. Can you see the slides?
No.
No. Okay, now look for them.
I try to fish back the slides. Okay, there we are.
Okay, go on the next on the slide after the one which blocked everything, and then start sharing again.
Okay, now I start to share again if I can, because I don't know where I am now. Oh, yes.
You don't find anymore the share screen? Okay. Okay.
You have it now?
Yeah, we are seeing the slide.
go to the next one.
Go to the next one before opening.
That's the next one.
Okay,
28.
okay. Perfect.
Do you have it?
All right, all right. You are all set.
Do you have it?
Yes.
I don't see them.
It's blue and
okay, great.
Fine.
Sorry about that. I deeply apologize. We move now to Leonardo, as usually, who was the first one who made the drawing of the Orti valve with asymmetry leaflets. And in the drawing of Leonardo, you really see very well that he was using the spiral, trying to learning and explaining the moving of the leaflets of the Orti valve. If we move to the heart, analyzing the cardiac outflow tract, is a spiral again present. This is the anatomy of the great arteries, but look at this geometrical drawing. If you consider this anterior, this posterior, right and left, the right ventricular outflow tract is anterior, the left ventricular outflow tract is posterior. You go up in the anatomy and you have a 90 degrees rotation with the aortic valve that goes on the right side, the pulmonary valve on the left side. You rise a bit the observation cut and you have the aorta anterior, the pulmonary artery posterior. So from the outflow tract of the right and left ventricle to the aorta and pulmonary artery, you have a spiral completing 180 degrees of rotation. If we move to the shells have a chirality, that means the direction of rotation as the formula in chemistry. Then we can have the mirror imaging of one of the other one. The same occurs for the shells, where they rotate towards the left or towards right with clockwise or anti-clockwise rotation. And curious enough, 90% of the shells and the snail rotate again clockwise to the right. In this representation, you have the possibility that we found in human heart. This is a sketch of the human heart. This is a sketch of a shell, where you can see we can have the situs solitus, which is the right rotation, the situs inversus or mirror imaging, where everything rotated on the other side, and very, very rarely a situs we call ambiguous, so there is no spiralized direction. If we replace the drawing with a true heart, this is a specimen, of course. This is a heart with the normal situs solitus. This is a heart with situs inversus, is a mirror imaging, and here there is the situs ambiguous. Again, in the congenital heart defect, 90% of the troncoconal malformation, the most complex defects, are rotating clockwise or to the right. This is the last slide I presented 2 years ago in the same meeting of modeling cardiac function in Varese, when I introduced my idea of studying the frogs. Why? The frogs are having a single ventricle. This is a sketch of the frog heart with the right atrium, left atrium, single ventricle with single outlet. This trunk was divided in 2 branches, right and left. And for some mysterious reason, the frog lives 20, 25 years and still jump, despite having a single ventricle, because they managed to stream the blood, the blue towards the pulmonary arteries, number 6 here, the red towards the carotid, towards the brain, and the mixed one towards the body. And this is the sketch of the inside with 2 inlets in a single ventricle, from the right atrium, blue blood, from the left atrium, red blood. The ventricular is not a cavity, but is a spongiform, crybrotic, full of muscle structure with a single exit where there is a source of spiral, again, partitioning the red from the blue blood. That's the secret of the frogs, and I wanted to learn why, to see if we can use it in our kids. These are dissections done by frog, not our frog, used by a colleague, then sacrificed. The frog heart is less than 1 centimeter, so to do this dissection, we have to use the microscope, and this photograph has been taken with the microscope. This is the posterior wall seen after opening the right and the left atrium. This is a suture through the tricuspid valve. This very thin, pliable tissue is the interatrial septum, in this case, moved towards the left side. Here we have the suture through the mitral valve. The septum has been moved towards the right side, and in no one frog there is any interatrial communication. 1 every 4 human beings has a foramen ovale. We have studied with echo and MRI 30 frogs up to now. No one has a minimal communication in their interatrial septum. So the result is this: you have the tricuspid valve, the mitral valve. This interatrial septum is completely separating the blue from the red blood, so there is no a complete streaming. This is seen from the ventricle. The ventricle has been open like a book. You see the ventricular cavity is not a cavity like in human being. It's full of trabecula, muscle, and so forth. So it's a poor site for blood mixing. And you have again the tricuspid valve, the mitral valve. This is the imaging magnified 5 times. Tricuspid valve, mitral valve separated at the inlet of the ventricle, and this is the exit, the truncal valve. So the blue blood from the tricuspid valve goes, first of all, into the truncal valve. The red blood from the mitral valve goes in the lower part of the ventricle to come out later. And this is what we found when we opened the troncoconus of the frog. Is open like a book, you see from anteriorly, with the 2 right and left branches, and you can see clearly with the magnification here, this structure, spiral shape, is a fibrotic structure, very pliable, elastic, like the cartilage we have in the ear. And this is the one who made the partitioning of the blood at the exit of the frog heart. These are our frogs. These are the last 2 frogs who underwent MRI Wednesday this week. And now they're back in their playroom having fun. This is the axial view or transversal view of the MRI, where you can see the left atrium, the right atrium, and this is the interatrial septum. This is the echocardiography, again, left atrium, right atrium. You see the interatrial septum is not straight, and these are the two atrioventricular valves, and this is the Doppler investigation with the systemic veins. The frogs have two superior vena cava and one inferior vena cava draining into the right atrium. The pulmonary veins are draining into the left atrium, and there is complete separation, no communication from left atrium and right atrium, so complete streaming. This is the MRI, again, with the axial view, where you can see the spiral in the outflow tract. This is the coronal view. These are the leaflets of the truncal valve, and I hope you can follow in this imaging the long spiral in the outflow tract from the ventricle, partitioning the blood. This is the same, the spiral in transversal section. And you can see on MRI, this is the atrial imaging with the flow from the pulmonary vein into the left atrium. This is the flow from the vena cava into the right atrium. And you see the shape of the interatrial septum moving systole diastole, and is not straight at all. This is the imaging, again, of the atrioventricular valve, a semilunar valve. You see two black holes here. This is the mitral valve, this is the tricuspid valve, and this is the semilunar valve or truncal valve. And you can see when the two atrioventricular valves are open, the truncal valve is closed, and the other way around. When they is closed, this is open. And this is the axial view, again, of the truncoconus, where you see the thick white imaging is the spiral, moving anteriorly in systole and posteriorly in diastole. In systole is facilitating the flow of the red blood into the carotid arteries and the aorta. In diastole is deviating the blue blood towards the pulmonary arteries. And this is my last slide. 90% of the galaxies rotate clockwise to the right. 90% of shells and snails rotate clockwise to the right. 90% of the truncoconal heart malformation, the most complicated, rotate clockwise. In the world, 90% of the people are right-handed and 10% left-handed. Is this a coincidence? The answer comes from one of the most famous mathematicians. God does not play dice. Thank you very much for your attention.
Thank you very much, Tony, for this very inspiring lecture. And it looks like you are not relying on coincidence as well, right? And I mean, we are running a bit late with the program, but still I would like to have the possibility for you of receiving questions and comments on your talk. So if someone is interested to comment on the talk of Tony, we have time for questions. Antonio?
Yeah.
Hello. May I ask one question myself, Tony? Start from the very last slide.
Yes.
Just to make sure. So you were saying that 90% of galaxies rotate on the right, okay?
That's not me. It's Michael Longo, a scientist in the University of Michigan.
Okay, yeah.
And he established, and of course, it's an approximative calculation, because you cannot calculate the percentage of all the galaxies of the universe. But from what is known, 90% are rotating towards right.
Perfect. But then you wrote at some point something that now I don't remember it very well, but you were saying that 90% of the valve, well, it was the last slide, And
troncoconal malformation.
yes, exactly.
Yeah.
90% were rotating which direction then?
Right again.
Right again.
This is controlled by some genes present in the world. Is a big family of genes called nodal with subgroups. And of course, the various subgroups are controlling the growth in trees, shells, snails, and so forth. And as they have been identified in the congenital heart defect. So they all belong to the same family of nodal genes. Of course, they are different, the ones from the trees and the shell and so forth. But are these genes giving the sense of rotation for the development of the troncoconal in embryonic life? And we can have heart rotating on one direction or the other. Of course, the right direction is the most frequent.
And if he's not rotating that direction, then this is key.
Let's say about 85–90% rotate towards right, 10% towards left, and less than 5%, they have no correct defined direction of rotation. So we call situs ambiguous. Are the kids born not with the liver on the normal situs? The liver is on the side, on the right, the spleen on the left, the right lung on the right, the left lung on the left. The situs inversus is exactly the mirror imaging. So the liver is on the left and so forth. The situs ambiguous, the heart is in the middle, the liver is in the middle, and the two lungs are or both right or both left morphology.
Thank you. So you were saying that 5% is not showing organized direction, no?
Or a bit less than 5%. It's quite rare.
And in this case, which kind of, let's say, what you actually see in these related to this organization?
Yes,
which kind
these
of
are the most complex malformation because everything has been so poorly developed. Then the patient are having always a complex of different malformation altogether. In any aspect, they can have anomalous connection of the systemic veins, of the pulmonary veins, everything wrong inside the heart, from the presence of defect or absence of atresia of one of the valves. The two ventricles can be one of the two poorly developed and the other one almost normal. And the outlet of the is always mixed up with obstruction in one of the two and complete abnormal positioning of the aorta and the pulmonary artery, which are in this case like a barrel, the two channels of the barrel, not twisted. So this makes the surgical management extremely complicated. They are very sick from the neonatal period, and these are the kids who require 4 or 5 operations before reaching the school age, if and when they can reach it.
Thank you, Tony. Thank you.